Hi, good morning or good afternoon or evening, depending on where you are joining us from today. We want to thank you very much for participating. We're really excited to share some information with you. My name is Julia Reed, and I'm the Director of Occupational Health and Wellness Services for Canada for LifeMark, and I'll be your host for today. I will be assisted by a number of individuals who are part of our conference planning committee. And this is our 8th virtual conference. So we're excited to have everyone. We've been doing this now for 4 years with great attendance. So thank you for participating. And for those of you who have participated before, thank you for your feedback in terms of the topics and so forth, so that we know what types of things that you're interested in learning about that we can share with you. We are recording today's conference, and we'll be sending out a link following the conference so that you can re-listen to topics, or also that you can share it with colleagues in your office on your team. To start, I would like to introduce Maria Maloto. She's our Vice President of National Programs for LifeMark Health Corp. To say a few words.
Thank you, Julia. So welcome everyone. No matter where you're joining from across Canada or beyond, we're thrilled to have you with us for today's conference on the benefits of using interdisciplinary care for case management. I'm Maria Miliotto, Vice President of National Programs at LifeMark, and it's a true pleasure to welcome all of you to this event. We're honored to have around 200 participants from coast to coast in Canada, and even a few from the US, bringing a rich diversity of perspective to our conversations today. At LifeMark Health Group, we also want to take a moment to acknowledge the Indigenous lands on which we work and connect. We are grateful for the traditional knowledge keepers and elders who guide us, for those who came before us, and for the youth who inspire us to build a future rooted in respect and reconciliation. We invite you to reflect on the history of the land you're on today as we collectively work towards positive change. We're delighted to see representatives from a range of industries and organizations here with us: WCB, NVA, and LTD adjusters, and also many employers and healthcare practitioners, all essential partners in the work we do. Today's presentations and discussions are designed to share timely, evidence-based insight that we hope you'll find valuable and actionable in your work. A heartfelt thank you to our panel of experts and the LifeMark conference team who made this event possible. Today, you'll hear from seasoned clinicians about how interdisciplinary care can make a difference in complex cases, supporting both clients and their teams in meaningful ways. This conference reflects core values we hold close at LifeMark: going the extra kilometer, doing the right thing, and of course, having fun. So sit back, enjoy, and let's dive in. On behalf of the LifeMark family, I welcome you to this great conference. Now I'll hand things over to your host for the event, Julia. Thank you, Julia.
Thanks so much, Maria. We just wanted to, for the session today, each speaker will have approximately 20 to 25 minutes to present their topic, and it'll be followed by a 5 to 10-minute question and answer session. If you do have questions for our speaker, feel free to put them into the Teams Q&A icon at the top of your screen. Our moderator, JC, will raise your questions during the Q&A time for that presenter. You can do this at the top of the menu bar, and it is the third icon in for those of you who haven't used it in the past. And please put your question in there, and she'll moderate them. If the questions are similar, she will combine them. Unfortunately, with a group of this size, we won't be able to have you turn your cameras on or ask questions verbally. And this just helps us to keep things on time and moderate things a little bit easier. So you'll note that the chat function has been disabled. Just after our second presentation, we're going to have a short 5-minute break so you can refresh your coffee, stretch your legs, take a micro break, and then we'll return for our final presentation and closing remarks. As mentioned earlier, we are recording today's event and we'll post it on the website by the end of the week so that you can share that. And the link is active for up to 3 months. And we'll also be sending out an event survey after and putting that information, a link for you. We appreciate you taking a few minutes to fill in the survey because it gives us information on how to prepare for our spring 2024 conference and make sure the topics are topics that you're interested in hearing about and learning from so that you can add some tool to your kits. So I'd like to introduce our first speaker, Dr. Brian Cater. He's our Director of Occupational Therapy. He's also our clinic director and occupational lead for Atlantic Canada. He's been an occupational therapist for over 13 years and has a lot of experience in rehab, disability management, and the return to work fields. He has a bachelor's degree in kinesiology, a master's in occupational therapy, and also a doctorate from Chatham University in Pittsburgh with a research focus on cognitive work hardening programs. Dr. Cater is the clinical director for many of our multiple interdisciplinary LifeMark clinics in Atlantic Canada, and we are very appreciative of the direction and the mentoring that he provides to those teams from both a mental and physical health perspective on those programs. He's also, as mentioned, the lead for Atlantic Canada on the employer side, so assists a number of employers with directing programs and services to achieve optimal employee wellness and disability management. So I'd like to introduce Brian to talk about what truly is interdisciplinary care.
Hello, everybody. Can you hear me?
We can hear you.
Perfect. Thanks, Julia. Thank you for that lovely introduction, Julia. I don't have to talk about myself now, so that's great. Just give me 1 second here. I'm going to share my presentation with everybody. And I think we should be good to go. If anyone can't see it, just let me know, but I think we should be good. Okay, so again, Julia, thank you for the introduction. My name is Brian Cater. As Julia mentioned, I am an occupational therapist by clinical background. I have a bachelor's in kin, master's in OT, and a doctorate in OT as well. And I have been working in this field for 14 years, and my main area of focus and practice clinically is in occupational rehabilitation and occupational fitness assessments. So I am a clinic director of a number of clinics here in Atlantic Canada, specifically in Newfoundland, and as well the occupational health and wellness lead for all of the Atlantic clinics that complete occupational health and wellness testing and employer services. So the specific clinics, I should say, that I am the director of here in Newfoundland we call them Fit for Work. That's the name of the clinics. We are part of the LifeMark Health Group. But a little bit about the specific clinics here, the Fit for Work clinics. They are a rehab facility with over 30 years of experience. Started primarily as occupational therapy clinic, but has grown over those many, many years to become interdisciplinary clinics. And the focus of the clinics has always been on occupational health and fitness and return to work. So the clinics do have a high level of experience with interdisciplinary care, as well as single service, of course, assessment and treatment. And this is from both a physical and mental health perspective. So we do service kind of both of those areas from an interdisciplinary perspective. And as I said, we are part of the LifeMark network. We did join in 2019, and we are happy to be part of the LifeMark family and the LifeMark team. So at our clinics, we, as I said, have a lot of experience doing interdisciplinary programs. We have a number of programs that we have and are currently still running that are interdisciplinary assessment and treatment programs or just assessment programs. So the PCVRS program is a national program that is completed at most LifeMark facilities. It's the Partners in Canadian Veterans Rehabilitation Services, and these are interdisciplinary assessments and treatment programs for veterans. And this is from, again, both a mental health perspective and a physical health perspective. CPCOE is the Chronic Pain Center of Excellence. So our clinic did a pilot project for the CPCOE, which is a research organization looking at chronic pain excellence and chronic pain treatment. So we did offer a interdisciplinary assessment and treatment program for the CPCOE to study the effectiveness of interdisciplinary care in treating chronic pain. We also run TPI programs in our Atlantic clinics, both in Newfoundland and in Nova Scotia, and these are traumatic psychological injury programs. So these are individuals who are on workers' compensation claims due to a traumatic incident in the workplace. So these are, again, interdisciplinary treatment and assessment programs looking at addressing the traumatic injury, the traumatic psychological result of that incident that occurred at a work site. As well, we ran for a number of years a purely assessment, interdisciplinary assessment program. It was called the Empower program, and it was used in both workers' compensation arenas as well as MVA and LTD. So this was a assessment with a number of different clinicians working together in an interdisciplinary perspective to basically establish what was going on with an individual and make recommendations for best course of action for treatment and how to move the claims and the clients forward in their treatment. So I do want to talk about what truly is interdisciplinary care. And a lot of different terms are thrown out there when we talk about interdisciplinary care, and sometimes people use them interchangeably, but they're really not. So, I want to kind of establish what is interdisciplinary care versus these other models and these other terms that are often used interchangeably with interdisciplinary. So while doing this, I want just to kind of keep it a little bit interactive. I know people can't really, pipe up and say anything, but I want people to be thinking about this case while we're going through these different types of care approaches. So this is a case of an individual, and we're going to call this individual Mr. Smith. He's a 47-year-old telecommunications technician. He's worked with the company for 15 years. They complete installation of and setup of telecommunications systems. So we're talking phone lines, internet, cabling, etc. So he enjoys his work, but a recent management change and staffing constraints have left him feeling a little overwhelmed and a little bit unsatisfied in his work. He was involved in a motor vehicle collision and sustained injuries to his right dominant shoulder, neck, and head, seen initially by his family doctor, diagnosed with soft tissue injuries and whiplash. It's now been 4 months, and Mr. Smith continues to have symptoms, and he continues to be off work. He is also struggling with activities of daily living. So these are things like completing home maintenance, household duties, engaging and interacting with his children, reporting some memory and attention challenges, maintaining good relationship with his wife. And he's beginning to feel a bit down and depressed due to this ongoing pain, his limited progress, and this guilt that he's feeling with his ongoing absence from work and his functional challenges at home. So this is a common, kind of case that we see in clinical practice. So I just want people to be kind of thinking about this while we're talking about these different models of care. So, just to provide some definitions here. So these are kind of the four main care models that I do want to talk about today and really kind of distinguish the difference between these. So we start off with a intradisciplinary program. We're going to talk about then a multidisciplinary program, then an interdisciplinary program, and then a transdisciplinary program. So they're kind of listed here in order of increasing complexity. So we will kind of go through them one by one in this order. So an intradisciplinary care type of program, it does have other names that it's sometimes referred to as. Sometimes it's called a single discipline or a single service stream or program, or it does have other names as well. But essentially what these types of programs are these are assessment and or treatment programs that are completed by a single individual from a single disciplinary perspective. So it's really limited in its scope of view, its scope of practice to only that one lens. So the downside of these things, obviously, is it often misses many important factors that can contribute to disability and chronicity, as we're not examining the patient holistically. Again, we're only looking at one specific field. We're only looking through one lens at this patient, and that really pigeonholes us to only looking at certain things. So despite the simplicity and the gaps with this type of care model, it is unfortunately a lot of times the most common approach in healthcare, and that can be for a variety of reasons. Could be access, or it could just be that that is what, a family doctor is most used to recommending. Someone comes in with an injury and we'll just send them for a physio assessment. And that's just kind of the groove that that physician maybe has gotten into. But there are a number of reasons why this could happen. But there are, as we'll discuss, better models than this. So thinking about the case that I just brought up in terms of Mr. Smith. So let's say for Mr. Smith, that is exactly what happened. His physician that he saw sent him for an assessment and treatment with a physiotherapist. Again, that's a fairly common thing for family doctors to do when someone presents to them with an injury and they're reporting mostly physical related issues. Maybe they mention some of the, mental health and more psychosocial issues as well, but usually their focus is on the physical. So again, common initial step for the doctors, refer to the physio. The physiotherapist is examining and treating the patient, so Mr. Smith, through this lens and through the scope of practice of a physio. So they are looking at the physical injuries. They're looking at pain. They're looking at range of motion, strength, and depending on the physio and that physio's training, whiplash associated symptoms as well. So using this intra-disciplinary care model, what are the issues? What are we missing? And, this is a question that, you guys can think about in relation to Mr. Smith. But, essentially, I won't get any feedback from people. I know it's going to be challenging in this type of environment, but just thinking about what's the downside to only an intradisciplinary care approach for Mr. Smith. Well, I think it's fairly obvious that we're missing so many important factors that are going on with this patient. We're only assessing one thing, one focus, one frame of mind. So, in the case of Mr. Smith, there was all of those psychological components and psychosocial issues that he was reporting. He was starting to feel depressed because he's not being able to engage with his kids and his daily activities and doing his home maintenance tasks that he would usually do. And his relationship with his wife is suffering. So these are things that we're not addressing through a intradisciplinary lens when we're only looking at the physical components. We're also often not looking at the job and the job demands. This individual, Mr. Smith, wants to get back to work. Are we looking at the job demands? Are we focusing his rehab physically to match the demands of that specific job? Because if that's the goal, that's what we want to focus on. We don't want him just being able to lift 50 pounds and focus on rehabilitating him so he can lift 50 pounds if he doesn't have to do that in his day-to-day activities and in his work activities. We could spend the time on his rehabilitation, focusing on other things that are more important to be able to help get him back to work. There's also the cognitive challenges that he reported in terms of the attention, the concentration issues he was noticing. So these are all things that are missed when we're only looking at someone's care through a single lens, a intradisciplinary approach. So to take that now to the next step, we can talk about multidisciplinary approaches. And as I said, multidisciplinary and interdisciplinary, they often are used together in conjunction to mean the same thing. But as I said, they're really not. So I want people to keep in mind like the differences in these terms. And I know they sound similar, but there are important differences. So multidisciplinary care. So this is essentially a program where assessments are completed by multiple individuals from multiple disciplinary perspectives, and each of those individuals is assessing and treating from their lens, from their scope. So in this type of case, we are hopefully looking at some of these things that were missed when we were talking about intradisciplinary care. So we do get a view of the patient from multiple perspectives, a more holistic perspective. We're addressing more of those domains of concern that the patient was reporting concerns in. Some of the challenges, though, with multidisciplinary care is putting it all together. Because oftentimes in multidisciplinary programs, the individuals are working siloed. So you've got your different clinicians. So different clinicians from different clinical backgrounds are seeing this individual, assessing and treating this individual, but there's not always good communication between those individuals. They're working in a siloed manner. They're not talking to one another. They're not collaborating together. They're not discussing the best approach to start with and then to move to this and then to move to that, working together for the most optimal care of this individual. They are just focusing on their own piece of the pie, their own scope of practice. So again, this is a better treatment approach than intradisciplinary, single discipline, where we're seeing the individual from more perspectives. But one of the main downsides with this is that it is a very siloed approach to treatment. So thinking back again to this case for Mr. Smith. So let's say in this case, he wasn't just referred for single discipline, intradisciplinary care with the physiotherapist. Maybe it was recognized that he's having these other concerns as well. So maybe his doctor sent him to a physio and also to an OT and also to a psychologist. So each of these clinicians is, again, assessing and treating based on what they feel is necessary from their scope. The good thing about this is that this client is being, seen, and they're addressing more than just those physical components. The OT is maybe looking at the cognitive side of things, the attention and the memory issues that he was reporting. The psychologist is looking at more of the mental health side of things, the depression that he was noticing from not being able to do the normal activities of his day-to-day life. So again, we're addressing more of these components that the client was having challenges with, but again, it's very siloed. So again, I want us to think about what's the main issues here in this type of situation where we're utilizing a multidisciplinary approach. Again, I think it's fairly obvious and fairly, easy to see that the biggest issue with this is it often comes down to communication and collaboration. The multidisciplinary approach doesn't really foster, doesn't really promote, doesn't really force that collaboration and that communication between these different professionals. They are often working siloed. So in this case for Mr. Smith, although there's an OT involved and a psychologist involved and a physiotherapist involved, we could still, unfortunately, be missing things because those clinicians aren't talking to one another about what's on the go, about their focus on the treatment, about the needs of this individual. So maybe the physiotherapist is doing some treatment, some physical rehab for this individual. But if that physio and the OT aren't talking, maybe they're missing, again, components that are specific to the job that the OT could pick up on, and therefore the physio might not be really honing in on those specific things in the physical rehabilitation of this individual. So there could be something missing there. Again, in the case for Mr. Smith, he reported that there was these issues at the workplace. It wasn't just the depression that he was feeling because he wasn't able to return to work and he wasn't able to do his activities of daily living. He also was reporting some dissatisfaction with his work recently due to this new boss he had and due to feeling, constraints with staffing levels. If that's not being brought up to the psychologist, then the psychologist doesn't have the ability to talk about that with the individual. So having these different clinicians not talk to each other, there's often things that are missing in the treatment. Even though, we've got all these different clinicians from different perspectives, the collaboration piece is missing. And we're also not looking at the best approach to take for this client that's getting this treatment. So the physio is focused on the physio, the OT is focused on the OT, and the psychologist is focusing on the psych treatment, and they're all doing it at the same time, but maybe at the same time isn't the right approach. But they're not going to know that unless they're collaborating, unless they're talking to one another. So that is often the main downside with this multidisciplinary approach. Again, it's got benefits over the intradisciplinary approach, but there are still some downsides to this. So next we come in that hierarchy I mentioned to the interdisciplinary care program. So what is an interdisciplinary care program? So similar to a multidisciplinary program, there are assessments and treatment happening from multiple individuals, from multiple disciplinary perspectives. But the thing to remember that's different between this approach and the multidisciplinary approach is that this is a team approach. So each of these clinicians that are working with the client, assessing and treating, again, from their own individual perspectives, from their own scope of practice, but they're working as a team. They're communicating, they're collaborating. So this integrates these separate disciplinary approaches into a single consultation and a single care plan. So there's not a care plan from the physio, a separate care plan from the OT, a separate care plan from the psychologist. They come together and they come up with a single unified care plan that's best for this individual. So each of these team members in the interdisciplinary team, they build on each other's expertise to achieve these common shared goals. So they work together to determine the best approach, the goals for this individual, and of course, the patient or the client is a member of this team, so they have input into what the goals are of treatment, and we are all working together on this plan. So The team, again, collaboration and communication is important. The team is often in a true interdisciplinary program. They're coming back together, meeting regularly to discuss the case, adjust and modify the plan as needed, talk about what's working, talk about what's not working, change things up if needed. That is the true difference between an interdisciplinary program and a multidisciplinary program is that collaboration piece, that communication piece, the team working together as one. So some really important characteristics of a good interdisciplinary team. So these are things that really need to be present when we're talking about interdisciplinary care. And so these things are number one, leadership and management. So having a clear leader and a management structure of the team is important. And it's important because we want to make sure that things are happening the way they're supposed to happen in the care of this individual. Reports need to be generated and reports need to go out. Who's going to look after that? If we don't have a good, clear hierarchy on the team, a leader on the team, or a management structure on that team, we can flounder. And maybe things get missed and the reports don't go out and notices aren't relayed to the entire team. So these are important pieces that a good interdisciplinary team should have. If there is no management or leadership, unfortunately, it often actually ends up becoming more like a multidisciplinary program because the leader is often the one that's facilitating this communication and this collaboration. So if that piece is missing, it oftentimes is more like a multidisciplinary program versus an interdisciplinary program. The other is the second important characteristic is communication. We need to ensure that there is appropriate systems in place to promote communication within the team, but not just within the team, with the client, with the patient, with other stakeholders. If there's workers' compensation boards involved or motor vehicle or LTD insurers involved, those are all stakeholders, and we need to have good communication between all of these individuals on what's happening, what the plan is. That is a key component to a good interdisciplinary team. Training and development is another important characteristic. The team should be continually improving and learning. And the thing with this is that not just their own scope of practice. That is important. As clinicians, we have a requirement to complete, a certain number of education hours each year for our licensing. It is a requirement that we are continually learning. But in an interdisciplinary team, it's a little, we have to take it a little further. It's important that we're learning more about our own profession, but it's just as important that we're learning about the other professions on our team. What do they bring to the table? How can I leverage that information, utilize that information in what I do, in my scope of practice? And not only that, learning and becoming a better team member. Teamwork skills. That's another really important piece when we talk about training and development for good interdisciplinary teams. The next is appropriate resources and procedures. So the team needs appropriate treatment and assessment equipment. They need the appropriate procedures in place, such as having recurring meetings set up. The team members all working from one location, working together. That's really important as well. They're not fractured and kind of all over the place. We work together. We have the appropriate resources to do that, to communicate, and the procedures in place to facilitate that. The appropriate skill mix, another important characteristic of an interdisciplinary team. We need to ensure that we have have a sufficient and appropriate skills and competencies, sufficient different types of practitioners to cover all the requirements that this individual might need. So if this individual needs an OT, a PT, and a psych, well, we need to make sure we have those on the team. If we need a physician involved, if we need a kinesiologist involved, if we need a podorthist involved, we need to make sure we have all of those individuals available on the team because we need the appropriate mix of skills in order to address all of the issues going on with this individual. The climate and the culture of the team is also important. It's important that the team is fostering a good working culture of trust, respect, and valuing the contributions of others. We don't want people on the teams that think their opinion is the best and everyone else is just a sidebar. The interdisciplinary program doesn't work that way. The teams can't work that way. Everybody is equal in an interdisciplinary team. Everyone's perspective is important and matters, and we need everyone's perspective in the care of this individual.
Brian, I'm just going to interrupt and give you a 2-minute warning. Sorry about that.
2-minute warning. Okay, I'm going to speed up. The other couple things here then is individual characteristics. So each member needs to possess certain characteristics such as clinical knowledge of their own profession, but also the others, and have a caring and patient-focused attitude. There has to be clarity of vision, so all team members have to be on the same page. We have to talk the same language, give the same messaging to the patient, have a clear set of values that direct our service. For example, work is good for health. If we're all thinking that same perspective and delivering the same message, then it gets to the client, it gets to the patient easier. The quality of outcomes, that matters. So we need to always be assessing, looking at our programs, doing satisfaction surveys, encouraging feedback, capturing that evidence and using it to further improve our program. That is important, an important piece of interdisciplinary care. And the last one, respecting and understanding the roles. Again, understanding our own roles on the team, but the roles of everyone else, working together, sharing power. It's not, again, one person is the important one and then the others are sidebars. It's everyone working together. So for Mr. Smith's case, if Mr. Smith was referred for an assessment and treatment by an interdisciplinary team, each clinician is assessing and treating based on their own scope, but as a part of a collaborating team. The decisions on the direction of care are made by the team through discussions about best practices and best approaches for this individual. The team brings in, any specialized clinicians that they feel are necessary for that patient's specific needs. And there's one unified assessment and treatment report and recommendations. It's not fractured. It's a unified approach. And we're able to address using this all the different components of the client and be a holistic assessment and holistic treatment. And again, the teams meet regularly to adjust, readjust the goals, refocus, discuss progress, etc. So thinking about interdisciplinary care, is there any issues still with interdisciplinary care? And you would think, well, this is the recommendation, this is the best one. So no, but actually there is. Unfortunately, with interdisciplinary care, because there is so many different individuals involved and extra time that might be required, it is often a more costly approach. But it is often the best approach. So I'll finish off just by talking about the last one on the list here, which was transdisciplinary care. So transdisciplinary care involves transcending disciplinary boundaries, sharing knowledge across disciplines. So it actually embraces overlapping skills and kind of blurring those traditional professional boundaries. So it creates a unity of framework beyond the individual disciplinary perspective. So essentially what we would have in a case like this is we would have one individual that maybe is looking at someone from the perspective of an OT and the perspective of a PT and the perspective of a psychologist, for example. We're transcending, we're getting beyond the traditional professional boundaries of this person does this person does this person does this. The problem potentially with this, though, having, multiple clinicians trained in multiple assessment and treatment approaches, it's hard to find clinicians that are trained that way. that are duly qualified as an OT and a PT and a doctor, let's say. It's hard enough to find a doctor in most cases, let alone a doctor that's also a trained physio and a trained occupational therapist and licensed in all three of those things. So it's often difficult to get to this point, and often licensing and legislative rules prevent us from getting to this. It is a fairly new approach in healthcare that they're really researching right now. But again, there is some barriers to this just based on, how it is structured. So really, the gold standard right now still is the interdisciplinary approach, and the collaboration between the individual team members and working together versus finding a team where it's a transdisciplinary approach where one or two individuals can actually do the traditional roles of multiple others. So I'll just leave it with this summary page here about, a quick description of these different approaches. And I guess we turn to questions now. So I will stop sharing my screen.
So thanks, Brian, for that, for your presentation and explaining the benefits of interdisciplinary care and what that truly looks like. I think a lot of times people, I know when I was doing disability case management and still do some of that today, looking at the different types are always trying to understand when is the best time to use this one or this approach. And interdisciplinary care often gets confused with some people think that, oh, I'm getting this, but I'm actually not. And so helping to understand how the team works together collectively to help move a case forward, I think you provided some really good clarity around that. So thank you very much for that. At the present time, what we're going to do is there's a couple of questions, but just for time and for the other speakers coming, what we'll do is we'll send out a written response to the people who participated today. I think there's 2 questions in the link and they're similar. So we'll touch base on that and send it to you with the video recording. So thanks very much, Brian, for your time today. We really appreciate you sharing your knowledge and expertise.
Thank you very much.
I'd like to introduce Corinne. Corinne is our clinic director for Universal, and she's going to introduce our next speakers that tie into the interdisciplinary care and how we work collectively together.
Thank you, Julia. What a pleasure to be here today. Good afternoon, everyone. It's a pleasure for me to introduce our next speaker. So Sohela Bandeli is a dedicated mental health occupational therapist with significant experience in the field. She is also the director of the virtual clinic that serves all of the clinics across Physiothérapies Universelles network in the province of Quebec, focusing on innovative approaches to expand access to care. Currently, she serves as the Quebec Regional Director of the Canadian Association of Occupational Therapy, where she passionately advocates for the profession, empowers clinicians, and strives to inspire the next generation of occupational therapists to make a lasting impact on the lives of those they serve. As an OT and as a dear colleague, it is my pleasure to introduce Mrs. Sohela Bandeli. Take it away.
Hi, thank you for the intro, Karine. I'm not going to reintroduce myself. I'm just going to launch my slides. Let me know if it works for everyone. All right, I think we're on. Can everybody see my slide and hear me?
Yeah. Looks great.
Awesome, thank you. All right, so I know that we're short on time, so I'm going to try to be strategic about this and present all the important information, but thank you for having me today and thank you for joining. I'm really excited to talk about the impact of interdisciplinary care. This is something that is really central to my work as an occupational therapist, especially working in mental health with cases that are becoming increasingly complex over the years. So why interdisciplinary care is so important? From my experience working with clients who have complex needs, I've seen how the collaboration between professionals really creates a comprehensive plan that addresses all the aspects of a client's well-being. So today we're going to be exploring three main areas. First, how interdisciplinary care improves the outcomes for clients with some real-world examples. Why and when adding other clinicians can enhance the care that we provide. And lastly, how interdisciplinary care compares to unidisciplinary care, especially in the return to work process, which is something that we work a lot in at LifeMark. So by the end of the presentation, I hope that you're going to see interdisciplinary care as something that is necessary, a practical approach that really enhances the support that we give our clients. So let's dive in and explore how we can apply this to our everyday practice. So Brian presented what is interdisciplinary care, but briefly at its core, this is an approach that is collaborative, where healthcare professionals from different disciplines really work together to develop and implement a comprehensive care plan for the client. This isn't just about working alongside each other. It's really about actively integrating our expertise to ensure that the client receives the most holistic and effective care possible. As OTs, we focus on enabling clients to perform the activities that are meaningful and necessary in their daily lives. However, we do sometimes encounter clients whose needs really go beyond our specific scope. And this is where I think that the strengths of interdisciplinary care truly shines. Now, there are some key components of interdisciplinary care, and those include, first and foremost, making sure that we have an integrated care plan where each discipline truly contributes its expertise to a shared plan that addresses all of the aspects of the client's needs. This is going to ensure that the care is not just fragmented, but really cohesive and aligned with the client's goals. Second, we need regular communication. So we really have to ensure that everyone is on the same page and that we're able to adjust the care plan as needed based on the client's progress and any challenges that arise. And lastly, we all have to work towards the same common goal for the client and with the client. This could be improving functional abilities, managing mental health symptoms. It could be facilitating a successful return to work. This shared focus really helps streamline our efforts and ensuring that every aspect of the client's care is working in concert. I personally find that this really matters because addressing the diverse and complex needs of our clients often requires more than what a specific discipline can provide. I feel like by working together, we can create a care environment that is truly client-centered, that is maximizing the potential for positive outcomes. And as Brian mentioned before, this approach not only benefits our client, but I feel like it also enriches our practice as clinicians, truly allowing us to learn from each other and continually improve the care that we provide. Now let's look at how clients can benefit from interdisciplinary care. By integrating the skills and expertise of different disciplines, we can provide a level of care that really addresses the full range of the client's needs, and that could be physical, that could be emotional, psychological, even social. Let's look at our first example of a client with depression that can benefit from both psychology. So for example, CBT to manage emotions and negative thought patterns, as well as a practical support from a mental health OT to reestablish their routines and set achievable goals. Over here, we can see that the combination often lead to more sustained improvement. Another example is in a physical re-injury workplace re-entry case. An OT may adapt the work environment and develop work strategies, while a physiotherapist can help restore movement and function, as well as a kinesiologist that could build on the physical strength and endurance. This integrated approach ensures that we have a better preparation for returning to work with a client, and we are helping them boost their confidence, their physical capabilities, as well as their resilience. So the key benefits that we see here is that this provides the clients with a complete support system where we have that holistic care that really covers all of the aspects of the client's condition, ensuring that they do feel supported both mentally and physically. A second key benefit is that interdisciplinary care equips a client to maintain progress and even prevent setbacks over time. So by addressing all of their different challenges that they are experiencing, they are better prepared to avoid those relapses or those re-injuries, ensuring that they are having that sustained well-being and resilience over time. So the collaborative approach allows us to tailor care to the unique needs of each client, ensuring that no aspects of their recovery is overlooked. And in my experience, clients frequently express feeling more understood and supported, knowing that there is a coordinated team that is truly dedicated to helping them achieve their personal and professional goals. Now we're going to look at when and why it might be beneficial to add clinicians to the client's care team. I do think that there's different scenarios where this could happen. The first one is usually from complex cases. So when a client is facing challenges that span multiple areas, sometimes having additional clinicians might be required. For example, if we have a client that is dealing with anxiety and stress due to workplace harassment, for example, it may be beneficial from the combined support of a psychologist and a mental health OT to have a bigger team here. The psychologist can address the emotional trauma, while the OT will help with the strategies with coping at work and interpersonal relationships. Additionally, we could always have a rehabilitation consultant from the insurance company that can play a crucial role here in facilitating the communication with HR, discussing the recommended workplace accommodation, and even sometimes ensuring that the client's needs are supported within their work environment. Then when clients have chronic conditions, I also feel like we can require support from more than what a single discipline can provide. Let's think of a client that has chronic pain, for example. They might need the involvement of a kinesiologist to address the physical conditioning, a psychologist for pain-related mental health strategies, and an OT for daily functioning, as well as lifestyle adaptations. So each discipline here really addresses the different facets of the client's experience, leading to a more comprehensive care. Also, there are times when a client's specific goals make it clear that additional expertise is needed. So a common scenario is returning to work, especially for a client that has been on leave for years and is now having troubles reintegrating the workforce. So this often requires a combined effort of an OT for functional skills and workplace adaptations, a psychologist for managing stress and anxiety related to return to work, and potentially a vocational therapist for career guidance and job placement. Over here, by aligning the skills of different actors, we can really tailor the interventions to precisely meet the client's objectives, providing them with the best possible chance of success. So the rationale for adding clinicians. First, I find that no single clinician can address every aspect of the client's health, but really by bringing all the different experts, we are ensuring that all the needs, whether they're physical, mental, emotional, and social, are met comprehensively. Interdisciplinary care is also not just about addressing those multiple needs, but it's also about customizing the approach to each individual. So by having a range of clinicians involved, the care can be fine-tuned to suit the unique challenges and the goals of the clients. Ultimately, the rationale for adding clinician is to improve the outcomes, and research actually consistently shows that clients who receive interdisciplinary care tend to have better, faster, and more sustainable outcomes than those that are receiving unidisciplinary care. This is usually because integrated approach tackle issues from all angles, making sure that we're leaving no stones unturned in the pursuit of the client's health and well-being. So in essence, adding clinicians is all about enhancing the quality and the depth of the care, ensuring that the clients is receiving the support that they need to achieve their goals. And by carefully considering when and why to expand the care team, I feel like we can provide that targeted and effective intervention that truly makes a difference. Let's dive into the advantages of team approach. By working together, clinicians from different disciplines can not only improve outcome, but they can also maximize their resources. One of the key advantages of a team approach is leveraging the unique strengths of each clinician. So for instance, as an OT, I might usually focus on a functional strategy, such as helping clients regain independence in their daily routines. However, meanwhile, a social worker could be added to assist with addressing external factors such as accessing community resources or navigating social support systems. So this combination usually ensures that the client not only receives practical support, but also accesses resources that are helpful in enhancing their overall well-being. Also, interdisciplinary care allows us to look at the client as a whole person. So instead of addressing individual symptoms in isolation, we're really integrated all of the aspects of their health into a cohesive treatment plan. This is also going to ensure that every aspect of the client's well-being is addressed, leading to a more sustainable and long-term improvement. Another advantage that we see when multiple clinicians collaborate is that the solution often become more creative and effective. So for example, if you have a client that is struggling with stress-related eating disorders and emotional challenges, a team composed of an OT, a dietitian, a psychologist can all work together. The OT would focus on developing daily routines and functional strategies. The dietitian would create a tailored nutrition plan to address the stress eating behaviors, and the psychologist can help the client to manage emotional triggers and develop healthier coping mechanism. So over here, we see that the multifaceted approach really helps a client overcome their obstacles in a way that no single discipline could really achieve on their own. And another advantage that I consider very important is that collaborating with other clinicians not only enhances clients' outcomes, but also helps build capacity and prevent burnout amongst healthcare providers. So by sharing the responsibility of care and reducing the burden on any single clinician and fostering a supportive environment, the team members can usually then rely on each other for fresh insights and emotional support. This team creates a healthier, more sustainable work environment, ensuring that clinicians can provide the high quality care without feeling overwhelmed or isolated in their roles. Another major benefit of interdisciplinary care is that it can reduce the costs in the long run. So when care is well coordinated, there is less duplication of services. So for example, clients don't have to repeatedly undergo similar assessments by different clinicians. And by addressing their issues early and proactively through the team approach, we can also prevent more serious and expensive complications down the line, such as hospitalization or even long-term or permanent disability. So this not only saves money for the healthcare system, but also reduces the financial burden on the clients. And interdisciplinary care is also more time efficient. So by having multiple clinicians working in tandem, we can often see faster results and reduce the total length of treatment. And instead of clients going through prolonged separate phases of care, they can benefit from coordinated interventions that really streamline their recovery. Additionally, regular communication between clinicians can save time for both the client and the providers, as we can quickly adjust the treatment plan without needing multiple appointments or long delays. So in essence, a team approach doesn't just enhance the quality of care, but it's also going to ensure that we're using time and resources as efficiently as possible, leading to better outcomes in less time and at a lower cost. This is going to make interdisciplinary care a win-win situation for both the client and the healthcare system as a whole. Now let's focus on how interdisciplinary care teams can work together to guide the client towards returning to work, which is usually a critical goal for many of our clients. So the return to work process is often a complex journey, and it's going to require addressing multiple barriers. And that is where the coordinated care team can really use their approach to truly excel. So it's all about that step-by-step approach, where at the outset, the team is going to conduct a thorough assessment of the client's capabilities, their challenges, their return to work readiness. This also involves understanding not just the client's physical and mental health status, but also their work environment, their job demand, as well as their personal goals. And together, the team can set clear, achievable goals that are aligned with the client's aspirations for returning to work. Phase 2 is about the tailored interventions from each discipline, meaning that each clinician really customizes their approach based on the client's unique needs and goals. These interventions are not generic, but they're specific to the client's condition, ensuring that every aspect of their recovery is addressed. And each team members really need to align their strategy with the others, creating that coordinated care plan that works holistically. This approach has to be flexible, allowing for real-time adjustment based on the client's progress and ensuring that the intervention remains effective and client-centered throughout the recovery process. Lastly, as the client progresses, the team needs to meet regularly to review the outcomes and adjust their care plan as needed. This ongoing communication is going to ensure that the interventions remain relevant and effective and that any new challenges are promptly addressed. The results of coordinated approach is that the client will receive a supportive pathway back to work. They benefit from the combined expertise of the team, which is not only enhancing their functional capabilities, but also building their confidence and resilience. Clients will say that they feel more prepared to handle the physical and emotional demands of returning to work, and they know that they have a support system in place to help them navigate any setbacks. To illustrate the impact of interdisciplinary care, let's compare two clients that had similar challenges, both presented with adjustment disorders and nightmares related to work, who received two types of care. So one is unidisciplinary and the second is interdisciplinary. So client A only received OT, focusing on functional abilities and daily sleep daily and sleep routine adaptations. While there was some progress that was made, underlying issues such as the overwhelming and anxious thought pattern, especially related to work nightmares around sleep, were not fully managed. As a result, the recovery took 12 weeks and the client was still fearful when returning to work. Client B received interdisciplinary care where both OT and psychology were used. So the OT worked on functional strategies while the psychologists were addressing the sleep anxiety and the coping mechanisms. So this integrated approach reduced the recovery time to 8 weeks with the aligned interventions and resulted in a more confident, successful to work. So this comparison shows that while unidisciplinary care can address specific needs, interdisciplinary care can provide a more comprehensive approach, leading to better, faster, and more sustainable results here. In summary, interdisciplinary care offers a 360-degree view of the client's needs, paving the way for a smoother, more confident return to work and to life. These case studies here really serve as a clear example of why expanding the care team can make the difference in achieving successful outcomes. Now let's look at some clinical outcomes and research evidence that support the effectiveness of interdisciplinary care. First, from a clinical perspective, in my own experience as a mental health OT, I've seen that clients who receive interdisciplinary care are more likely to successfully return to work and also report higher satisfaction of their overall care experience. When we incorporate multiple disciplines, clients not only engage more fully in their treatment plan, but also feel more supported throughout their recovery journey. Research evidence also backs up these observations. So studies have shown that interdisciplinary care can significantly enhance return to work rates. For instance, research indicates that clients receiving combined OT and psychologist support can exhibit a 30% increase in a successful return to work outcome compared to those receiving OT alone. So this improvement is often attributed to the ability of the interdisciplinary team to address the various barriers that the clients face. Moreover, studies have highlighted that interdisciplinary care is associated with shorter recovery time and better overall health outcomes. This is because a team approach often allows for more comprehensive assessments and interventions where each discipline can really quickly address the emerging issues within their scope of practice, reducing the delays in treatments and enhancing the effectiveness of care provided. So we see here that interdisciplinary care consistently outperforms unidisciplinary care approaches when it comes to client outcomes. It's really all about the synergy of combined skills and perspective, allowing us to provide a more robust client-centered approach that is not only meeting the client's needs, but often exceeding them. This leads to not just improved health and functional incomes, but also greater client satisfaction and usually more overall positive care experience. To bring everything into focus, let's look at real-world examples and impacts of interdisciplinary care through client testimonials and success stories. So for a client testimonial, I had one of my clients who was struggling with anxiety and burnout. She said that before this, she felt that, well, I'm just going to quote her, before this, I felt like I was tackling my challenges alone. The team showed me that I didn't have to. Each professional focused on a different part of my recovery, and together they helped me move forward faster than I thought possible. So I find that this really highlights how interdisciplinary care can improve and offer that shared and collaborative approach, helping the client progress more efficiently and confidently. Now for a success story, a client who had finished cancer treatment was referred to me by a funder to help with cognitive challenges like memory lapses and emotional struggles such as anxiety. Initially, unidisciplinary care really focused on that cognitive rehabilitation, but some of those emotional symptoms remained a barrier. And after expanding the care team, including a psychologist, we were able to address the emotional and cognitive needs. And this holistic approach really restores the client's confidence, allowing them to return to work feeling more resilient in managing both mental and cognitive challenges. So this real-world application really highlights the importance and the outcomes of interdisciplinary care, where we can see that there is greater client satisfaction and engagement, as well as more resilience from the clients who are also now better equipped to handle future challenges. Finally, let's consider how we can apply the principles of interdisciplinary care in our daily practice. So making interdisciplinary care as part of our routine doesn't need to be complicated, but I find that it does require us to be more intentional about the steps that we're undertaking to ensure that collaboration is effective and client-centered. One of the first steps is to establish regular team meetings where all involved clinicians can come together to discuss the client's progress and adjust the care plan as needed. Shared goal setting during these meetings is really going to ensure that everyone is aligned and working together towards the same outcomes. And sometimes using electronic health records can greatly enhance that communication, allowing the team members to easily access updates and keeping track of the client's progress in real time. Effective interdisciplinary care also depends on clear communication and well-defined roles. So each team member should really know how their specific responsibilities and how their role fits into that larger care plan. And those regular check-ins and open communication are going to be crucial, ensuring that everyone stays informed and can contribute to their expertise when needed. Some actionable tips, start small. So if interdisciplinary care is new to your practice, begin by integrating one additional discipline for a specific client need. For example, if you have a client with suffering with both mental health and physical pain, consider adding a psychologist or a kinesiologist to the team. Observe how this addition impacts the client's outcomes and use this as a foundation to expand further. Try to regularly assess the effectiveness of your interdisciplinary care and approach. Do you find that your clients are meeting their goals? Are there gaps in the communication or areas where the team could work more cohesively? Usually using these insights to continuously refine the approach is going to ensure that we remain effective and client-focused. As we wrap up, I encourage you to consider how you can integrate and enhance your current approach to use interdisciplinary care in your practice. Whether you're already working in team setting or are looking to start collaborating with other clinicians, explore the opportunities for interdisciplinary care and how they could benefit your clients. Ultimately, interdisciplinary care is about working together to provide higher quality of care for our clients. And it's really about recognizing that as a team, we can achieve more and also make a greater impact than we ever could on our own. So I hope that all these insights are going to be used to start building and continue building that collaborative and client-centered approach in your work. I'm happy to answer questions if there are any.
Yes, thank you so much. That was excellent. I think we have a number of case managers and adjusters on this call and attending the conference. And so from their perspective, how would they know when to refer for interdisciplinary care? Like, should they start with single discipline and add interdisciplinary, or do they just always refer interdisciplinary care? Like, what would be your take from their perspective?
I think it really depends on the setting and how they're currently used to working. It is about that trial and error process as well. I think Brian explained it before. Sometimes, for example, even doctors are just like used to referring client to one single discipline, so they don't have this habit from the get-go to use different people on case. But I find that the most important step is really increase our knowledge on what is it that each discipline does, so that you understand how they can work better and develop your sense of, is this going to be helpful to the client? If you don't know, start with that first discipline and ask them, because usually the healthcare provider is going to know who else is on the team and how they can work together. So really starting to build that reflection about how we can help the client better as well here.
Thank you. And I think we have time for one more question. So again, as an adjuster, how would they understand if a clinic is or interdisciplinary in nature? Like if they could send a patient anywhere, how would they know to send it to your clinic, apart from knowing your name now?
That is a great question. I think that, again, it's always about like knowing it's always about building that network, I would say, first and foremost. So whoever they're used to working with and questioning them as well. But I think that we have to make an effort to become more interdisciplinary care. And I think that it's fair sometimes to challenge the clinician that you're working with to know if they can work with other people. I know that at Physiotherapy Universelle and LifeMark, we are really working on that 360 vision to make sure that we are all using our strengths from different disciplines to work with clients. So this is part of what we do at work. This is part of how we're trained to work here. But it's fair to ask and to see how they can start working together. But then having that process where we start having more communication, having those structured meetings where everybody can come together, really promote that interdisciplinary care can also help keep developing this on cases as well here.
Perfect. Thank you so much.
Thank you.
Thanks, Leah. I really appreciated the cases that you shared to show how OTs and psychologists can work together to help achieve some really good outcomes on files. And I think a lot of times when we can work collaboratively, as you mentioned, and that you shared with us, we can have those better return to work successes. Because when we're working in isolation, as both Brian and yourself had said, sometimes there's pieces that are getting missed or components. So thank you for sharing your personal experiences and your insights into that with us. I just wanted to let all the participants know in today's conference, we're just going to be taking a 5-minute break. So please stretch your legs, grab a coffee or a tea. The slide deck is going to run for a few minutes, and we will reconvene in 5 minutes at 1:10 Eastern Standard with our third speaker, who Corinne will introduce at that time.
All right, welcome back, everyone. I hope everybody's having a great time. This is a fantastic presentation. I love it. So let's talk about our next speaker. So Dominic Prévost is currently a guidance counselor, psychotherapist, and accredited specialist in the assessment and diagnosis of mental disorders. He is also a PhD candidate in occupational and organizational psychology at the University of Quebec in Montreal, and is working on developing better psychometric tools and strategies to improve transition of veterans from the military to the civil workforce. He is specialized in the evaluation and the psychological conditions of patients, including mental disorders, and in professional vocational services, including the administrating and interpretation of psychometric tests. In 2017, he received the award of the most emerging professional from the Order of Guidance Counselors of Quebec. It is my great pleasure to introduce a longtime colleague of mine, Mr. Dominic Prévost.
All right.
Enjoy the presentation.
All right, I'm going to share my screen right now. All right, should work right. Everything's worked? Yeah.
Looks
Perfect.
good.
Okay, so thank you for having me, and it's going to be a little different for the third workshop. I hope you have enjoyed the previous workshop. It's going to be a little more spontaneous in my approach because I'm well known for that. I'm going to talk to you about a specific subject here. I'm going to talk about guidance counseling and psychotherapy. Of course, we stick with the subject matter here, interdisciplinary care. So we're going to talk specifically about what I'm doing and what research tells us, and of course what I'm doing right now with my director in the university for everything related to when is it a good time to add a guidance counselor or psychotherapist or both into interdisciplinary setting. So before we begin, just want a quick disclaimer. English is my fourth language, so I'm sorry if I just mix some words or anything like that. It's really hard to talk many languages sometimes, but I do my best. If something is not clear, please just ask the question and I will respond. So, okay, a quick presentation of myself. It's already done, but we're going to talk about what I call the fields of impact. Everything related to the second point here will be related to academic research, and I'm doing right now with my director, and we have interviewed many people, veterans and other persons, civilian persons, to know what kind of impact a guidance counselor or a psychotherapist can have on a team. So I'm going to talk specifically about the result. I'm not here to talk about methodology or research settings or anything like that. Just the result, it would be enough. But if you have questions, don't be shy. And at the end, I'm going to talk a little more about my experience and what my colleague told me about advantages and benefits. It's going to be more a complement of what we already talk today about the two previous workshop. So, yeah, it's me. We talk about, just for those who doesn't understand what is a guidance counselor, maybe you have already consult a guidance counselor. It really depends where you are right now. But here in Quebec, we have an order that it is right, you need to be registered. So when you see a guidance counselor, is because you question yourself, or you question about the job you're doing, or about the task you're doing. It could be an existential crisis, so it can go very far. It's not just giving information about what kind of program can I do. But when you are a guidance counselor, you can also become a psychotherapist, accredited specialist, a mediator. You can become a lot of things. So it's like the basic, and you just build after that. So let's go with the 5 major fields. Let's not waste time on this. So it's not published yet, but so you have the results very quick before everyone else. It's going to be very soon. The article will go in English, everything quite soon. But for now, I'm going to talk about when do you think, or when, I should say, when it is the best time to have a guidance counselor or a psychotherapist in your team, or you need to add that kind of person. So I'm going to talk about 5 major fields. Of course, the first one is well known. So when a patients have health-related limitation, we can think about adding these kinds of professional. And when I say health-related limitation, I'm not talking just about physical limitation. We can talk about psychological, social, relational, cognitive, contextual. There's a lot of limitations that can happen and can affect health. So when you see that someone has more than what is been referred to, we can have questions. Would it be great to have another professional here? So here we have 4 variables because mainly it's mostly like for successful return to work or successful rehabilitation. This is what's really important. So when there is clinical symptoms is the most classic one, but it's very surprising because in our research it's not the most significant one. It's still important, but it's not the most significant. So it's not because someone has major clinical symptoms, PTSD, depression, anxiety, that he's going to have more difficulties than another person to reintegrate a job or training or just his functional life. But still, if you see that people can manifest the type of clinical symptoms, this is relevant to have a guidance counselor or a psychotherapist. When there's fear of relapse too, it's important because it could be like because fear, it could be actual, but it could be imaginative too. So everything related to when people fear that, oh, even if I have benefits, even if I have a team, even if many people are behind me, I still fear of a relapse, of not succeeding. So that could be a good moment to think. When there's substance effect, of course, that could affect something really major in the rehabilitation process, or cognitive issues. Cognitive issues is really important because most treatment plans, when we see when the actual research doesn't include cognitive issues. Some people do, of course, but many reports doesn't include that. And we do cognitive evaluations. It's when you're a psychotherapist, sorry, or a guidance counselor. So that could be a good moment. The second field here of impact would be when there are interpersonal barriers in the work setting. When I say work setting here is important, it's not just someone work. That could be someone just don't work and has, for example, burnout or have another project. It's quite large here. So when you feel that someone feel isolated in his workplace or her workplace, or have many apprehension of difficult relationship with coworkers or supervisors, this is a red flag. This is something that should not be ignored, because usually that could prevent a successful return to work or successful rehabilitation. And it goes, of course, way beyond the health-related limitation that I just talked. After that, we have adaptability difficulties. Adaptability difficulties are usually the difficult to evaluate because nobody is the same. We have our strategies, and it's really rare that we talk about adaptability to many levels. And our research right now tells us that adaptability difficulties are the main significant variables for successful rehabilitation. So, like I said, it's not clinical symptoms like we could have thought. So when I say adaptability difficulties, it's like between health-related limitations and return to work. So there's a step between that, and it should be addressed. So it could be related to the workforce, work demands. And work demands, is it too low, too high? It's really important to evaluate that. And related to the work environment, it should be very, very clear that which kind of environment the person can go back. Because it's not because they have worked to a place that they can adapt to that place anymore or in the future. It's really need to be evaluated. If it is not evaluated or it is not part of a plan, even if there's no psychological impact or condition, I think it's important to maybe think about, okay, maybe we should work with our guidance counselor or psychotherapist to make sure that we can have that kind of information. Because when people fail, for example, to go back to work or go back to a project or just to adapt to their life, they usually talk about environment. Oh, the environment was not with me. It was hard to just adapt and go beyond what we say. People are difficult. This is the kind of thing that we can think I feel stigmatized, something like that. So it's very important. The other one is work-life balance difficulties. So it's something that we can often miss, especially when people just talk about their work or just talk about functionality, chronic pain, things like that. It's really important to evaluate the other spheres. Social, does he have active support? Is or project is related and perspective with the difficulties they could live in a personal life, for example. So the fourth one is vocational obstacles. The vocational obstacles, I'm sure you have heard about that. It's mostly related to vocational assessment, vocational process, guidance counseling. And we often think about the two first variables when we think about that. And many programs are oriented, unfortunately, on these first two. When I say first two, I mean the labor market barrier and the job search. So yes, they are important, but again, this is not the most significant. It's quite surprising. The most significant would be the last one. I'm just skipping a few. That would be the vocational and career confusion. This one, it could be very important just to ask questions to the patient, even if I'm not talking about it with you, just to have some kind of quick question to evaluate if he is or she is confused about her career or vocational. So, for example, we could ask, do you feel that you are vocationally well-oriented? Just that kind of question gives you a great insight and hints about what could we do next? Because if someone has vocational or career confusion, he has 4 times less chance to succeed compared to the other ones. I don't have the numbers, but it's not 4, of course. So this one is a major one. Of course, I skipped the work motivation. So even if you have no confusion, there are no barrier or anything else, motivation is really important. Some people, when they have been injured or they feel that they maybe be betrayed by the employer or people around them, they can feel that the motivation goes very, very low. So it's important to address that too, and not just skip it and just stick to the plan with the functional limitation, for example, go beyond that. So after that, we have the experience and skill-related challenges for keeping a job. This is one major errors that we see with people, even in interdisciplinary care, is that we often think that he can go back to what he or she was able to do before. So it's not really the case. Not because someone has experience or skill related that he can do the job again or keep the job again. So it's really important to just ask yourself, okay, what else can he do? What else could happen? Can you have another project, for example. So for the last one is stigmatization and support. Here, the research talked mostly about mental health and handicap, but it can go beyond that. Okay, we can think about gender stigmatization, self-stigmatization. I'm working myself with military stigmatization. So when people feel that they are stigmatized and they can go beyond the etiquette that they have been given, I think it's very important to maybe put a stop and just address that, because it could be a game breaker when like we said, you could need someone else to address that. And in psychotherapy and guidance counseling, we can do both. We can do that, no problem. And the last one is a lack of support and discouragement from work and non-work actors. So again, just ask questions. Okay, what is your support? Do you feel encouraged? What kind of encouragement do you receive? Try to go beyond okay, you succeed to do a little more this week. Okay, just talk about everything else that is related. And if you feel it's not your role, just suggest someone else. Just suggest that someone could enter the program, the rehabilitation program, to help and to address that, to make sure. Okay, so for the next part, I'm going to talk about advantages or benefit, if you prefer, for interdisciplinary care. It comes from, yes, I did a little research here, but it also includes my personal experience and many colleagues that I have interviewed before this virtual conference. And there are 3 advantages or benefit that comes in mind, and I will share it with you. I know I don't have much time, so I'm going to be very quick. I think interdisciplinary care, from what we see in research and, of course, practical experience, you can go beyond your expertise to optimize the patient return to work or return to another project. When I say return to work again, that could be larger than that. Going beyond your expertise is not something that is natural for everyone, because when maybe you did university and you become an expert in your field, and when you just talk with people on your field, you don't necessarily always improve. You don't have many other ideas. So to go beyond is really great, because when you feel you are limited on something, when you feel that you cannot help someone, well, there's always someone else that can help you with. So here, I talk a lot about guidance counselor and psychotherapy, but you have other examples here. So we can have social worker to address substance effect, because yes, I can address substance effect myself, but social workers are better than me. They can have a plan, they can have resources and everything. Psychoeducator, exposure therapy, putting in action. Okay, we talk about mental health therapists in the last workshop, so I'm not going too far on that. I think you know that what it is, but also physical. I think it's important for psychological and physical professional to talk, and it's not something that is natural for many people, because we can talk different language, but it's so insightful. For example, as physiotherapists, they can give me implementation or insight on the vocational possibilities of the patient, to talk about chronic pain, these kind of things that can help, and I can give them information. And sometimes it's just a quick talk. Sometimes it's something way bigger, 2 processes at the same time. That would be the best world, but like I will say later, when we have many processes at the same time and working on different spheres, the treatment plan is reduced. Every research say the same thing. So for the second one is to break the potential actual therapeutic plateau. I don't know if you ever been in a psychotherapy process or vocational services, but if you do, you understand that it's a very specific process, and you need to be in a certain posture for it to succeed. For example, you need to not have too much mental charge, you need introspection, you need openness to make sure to have some kind of results that is significant for you. But of course, not everyone has that kind of posture. So when you meet someone that needs these kinds of services, but are not in the good posture, we need to think what kind of things we should address first. What is the priority? So just taking an example, just to make it myself clear. We talk about a physiotherapist just before chronic pain. For example, if someone comes see me and I have major chronic pain, he needs to be evaluated, psychotherapy or vocational. Of course, if someone who has major chronic pain, maybe will not be open or to have energy for introspection. So maybe it's important to address both at the same time, chronic pain and after, at the same time, psychotherapy, vocational. So we can break a therapeutic plateau here. We can you can let other professionals to break obstacles to have the patient getting back in the process. For us, for example, guidance counselors and psychotherapy, we can put a pause on the process if need to refer to a colleague and continue after something in a different sphere. If you can be flexible, usually we have better results. But unfortunately, many persons, professionals within the research that stick to the patient and want to help them on as much as they can on many spheres, and sometimes it's not even their expertise. We are all empathic, you are all kind, but sometimes it can help the patients or the client to see someone else, and after that you can come back see you, no problem. So for the last one, it would be to work together toward the objective of the patient. I think it's already been told, so I'm going to be really quick. But interdisciplinary care, you can establish together the limit of the expertise. I just talked about it and the needs of the patients. And just it's easier, I think, to put micro objective and working with the patients. And it's important here with the patient. So it can add objective is insight, can talk, oh, my professionals say that, but the other professionals say that. How could this fit together, for example? And we can do case conference every 4 weeks, punctual meetings if obstacles are still present. So that was the third one, that research and my personal experience for the benefit of interdisciplinary care. I will just finish to tell you what I have found on the literature, but also what I think about the difference of interdisciplinary and interdisciplinary. Treatment time could be reduced for approximately 6 months when we are in interdisciplinary. So it's major because it's major for the insurance, so it's major for the clients, major even for your waiting list. So think about it. It's not true that adding more people give more treatment time. It's going to take a longer time. Of course, it need to be the right professional, the right need, of course, but it's the contrary that says the research. We also have better outcomes because, again, repeating myself, more gain at different spheres of the patient's life. Of course, we're going to have better outcomes, optimize his chance to integrate a work and maintain it or any other project. I found that it opened my mind to new solutions, to new outcomes. Because yes, we can do as much training as we want. We can go back to university. I'm doing myself a doctorate in my free time, but to talk with other persons who have other expertise, who have other experience, it gives me more solutions that I won't feel limited when someone has a new problematic or something different that happens in my office. It gives creativity, innovations. It's really great because it comes naturally after that. You have, oh yeah, I remember that specialist talked about this and you feel with that, so you should, it's easy to go beyond that. And finally, but not the least, it can help to prevent psychotherapy fatigue or vocational resistance, which are the two consequences that we see sometimes in our office. It's not easy because when people are just in the very long-term psychotherapy setting, there can be some kind of therapeutic plateau, but also fatigue. We don't advance anymore. So some people just maintain, but we can go beyond maintain. We can go with other outcomes, other things. And vocational resistance is usually comes when there is something else that prevent the person to advance. It goes beyond the vocational confusion here. We talked about other spheres before, so it could be chronic pain, it could be substance effect, it could be work motivation, anything. So interdisciplinarity reduces the risk of these two happening. So I think it's 21 minutes I did. So if you have any questions, That would be
Thank
a
you.
good
That was great. And a nice different approach from the earlier presentations as well. I have a question for you. With respect to the different types of fields that you had presented, is there one discipline that might be more successful with a return to work, for example, guidance counseling or psychotherapy, et cetera?
Okay, when we talk about discipline, yeah, it's really hard to enter that because it really depends on the needs of the patients. All I can tell you is usually when we deal with vocational confusion and adaptabilities, difficulties, and stigmatization, these three, we have better chance for a significant return to work. So I should say guidance counselor, but psychotherapists are very important too. But it's very rare that we have a guidance counselor in everything, but in that field. But I feel that if you can find a professional that can take these three spheres, you have a better chance for a successful rehabilitation.
Thank you. And then again, from that case management or adjuster lens, I had asked a similar question to the last presentation. At what point in time do you think, from your experience, is the right time to add some sort of psychoeducator to the claim or to the file in order to work on those components as well?
Okay. I think this is important because I know that having a guidance counselor, maybe now is not the first person we think when every rotation process we talk about limitation and everything, and that's okay. But someone need to do an evaluation quickly about vocational identity, vocational obstacles, psychotherapy needs. Why am I saying that? Because it varies on the person. For example, if you feel or if you evaluate that the vocational sphere is very important, is limiting to the person, even if he's at the beginning of his rehabilitation process, that could be a great time to have a guidance counselor. But for other person who are maybe well comfortable with ambiguity, to say, oh, that's okay, I'm just going to rehabilitate myself, and after that, I'll think about vocational, we can put it at the end too. So it just depends how much anxiety or anticipation the patient have.
Fair enough. Thank you so much.
Thank you so much for your presentation, Dominic. And I think that's one of the big challenges on a lot of the files that we see coming in is things are much more complex and concurrent. There's not just that physical side, there's that mental health component that we're seeing more and more on any of the files that we're managing. And so by taking that interdisciplinary approach and having different types of clinicians working on the file together to provide support and treatment to these individuals just helps better further that return to work outcome or even activities of daily living, because they're getting that support from a number of different professionals who are on the same page in terms of what the goals are. And so I think that's one of the important things. I know oftentimes we think, well, that adds cost and so forth. But I think when we look at the cost benefit as well, when we can have that up front and many people are working on that file, that outcome is better, which in fact then we're looking after the patient, and that's what's most important, but then those other things come, the other benefits. So thank you very much for your presentation today. I'd just like to do a few closing comments just to thank all the participants who attended today and your participation with the questions. We hope you've enjoyed the fall conference, and we'll be sending out a short survey. It's a link that will come to you to get your thoughts on the event and to give us some ideas for planning for our spring conference in April. The survey only takes really about 2 minutes or so to complete, and it's really important to make sure that we can gear this towards yourselves and the issues that you're facing today. Just a reminder, if you do require a certificate of completion, if you can just please email me at julia.reid, R-E-I-D, at lifemark.ca. I'm happy to provide one to you. Thank you again for your attendance, and we look forward to seeing you in the spring of 2025. So have a great day, everyone.